Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson on the different types of diets that are used in IBD. So it is well known of the importance of a well-balanced diet for optimal health. However, little thought is given on the importance of the well-balanced diet on gut health. Optimal nutrition is important for the regular functioning and maintenance of the gut, as it can promote homeostasis of the gut microbiota and levels of gut inflammatory markers. Despite there being an agreement by experts that there is no specific IBD diet that can be endorsed to help in establishing remission in those with active IBD, there is a belief that it is possible of influencing the activity of IBD through nutritional strategies, especially as there has been positive results from using exclusive enteral nutrition at inducing remission. Due to this, there has been much research at looking at the role of food, more specifically components of food that are pro-inflammatory, in the contribution of developing IBD. However, this research remains in the early stages of development and should not prelude to the fact that when it comes to health and nutrition, we are all different. Just like doctors designing treatment regimes for IBD to be tailored to the individual, nutritional approaches are the same and should be done with the help of a registered dietitian or nutritionist. While nutrition professionals implement food exclusion techniques to identify trigger foods, it is advised that exclusion diets cannot be recommended to induce and achieve remission in those with active Crohn's disease, even if that person has intolerances to certain foods. So the most common diets people with IBD follow are the low-fat, fiber-limited exclusion diet, or known as the LOFLEX diet. This was developed after it was noticed that patients with Crohn's disease often exhibited a flare-up of symptoms once they ate foods that were high in fat and fiber. This dietary protocol involves the use of exclusive enteral nutrition to be used beforehand in people with Crohn's disease to try and achieve remission before following a food reintroduction plan, eliminating food which are high in fiber and fat. It involves being supervised by experienced dietitians and nutritionists, as a food diary is needed to be kept, noting down any symptoms experienced while reintroducing foods. Another diet is the low-FODMAP diet. People with IBD can also exhibit IBS-like symptoms even when their IBD is in remission. And it has been suggested that diets which contain a high amount of fiber can bring about these IBS-like symptoms. So the low FODMAP diet actually stands for the low fermentable oligosaccharides, disaccharides, monosaccharides and polyols diet. And this diet seems to be beneficial in people with IBS, and as a result has gained a lot of attention with those that have IBD and IBS. Now, FODMAPs are sugars that our gut finds difficult to break down, with the majority being fermented in the large intestines. These sugars include fructose, lactose and polyols, and they are a source of food for the bacteria in the large intestines, with the byproducts of them using it as food triggering symptoms like bloating, abdominal pain, diarrhea and constipation. It should be noted that the relationship between FODMAP intake and inflammation of the intestine is unclear, and that despite the possibility of gaining relief from IBS-like symptoms by following a low FODMAP diet, the risk of further nutritional deficiencies is high. This is because people with IBD are already considered as undernourished and nutritionally compromised due to their IBD, and that the low FODMAP diet is very restrictive and can further compromise the health of the individual. If going on this diet, it's of vital importance that supervision and advice from a registered dietitian or nutritionist is sought. Then we have the specific carbohydrate diet. So the concept behind the specific carbohydrate diet is that it excludes more complex carbohydrates while only allowing the intake of simple ones, as they are easier to digest. Complex carbohydrates tend to be poorly digested and so are used as a food source for bacteria in the large intestine, causing fermentation and overgrowth of bacteria and yeasts. This leads to dysbiosis and, like the low FODMAP diet, triggering symptoms. The specific carbohydrate diet is not a form of low carbohydrate diet, but instead it is a diet that is principally composed of monosaccharides, solid proteins, fats, fruits and nuts so that reduced amounts of disaccharide sugars are entering the large intestine. This is in the hope that any alteration in the gut microbiota and dysbiosis is either prevented or reduced while still providing sufficient nutrition to the individual through the consumption of mainly monosaccharide sources such as fructose, vegetables containing a higher amount of amylose, butter or oils, and solid proteins. Next, we're going to look at the anti-inflammatory diet. So the notion behind this diet is to reduce inflammation by consuming foods and spices that contain anti-inflammatory phytonutrients and omega-3 polyunsaturated fatty acids. This is a diet that is rich in fruits and vegetables which are rich in antioxidants, and even though animal proteins are allowed to be consumed, this diet leans more towards the consumption of plant proteins. There is a nutritional regimen of this diet in IBD patients, and it is known as IBD anti-inflammatory diet. It is derived from the specific carbohydrate diet, but it allows for the consumption of grains and gluten, making it less restrictive. IBD aid also involves consuming omega-3 fatty acids and focusing on reducing the amount of saturated fats, and has 5 basic phases to it. Next is the Mediterranean diet. So this is closely related to the anti-inflammatory diet as it focused on increasing the uptakes of foods that are high in phytonutrients, unsaturated fats, omega-3 polyunsaturated fatty acids, and whole grains, while decreasing the number of red meats consumed. It has been seen that this diet can contribute to a reduction of inflammatory markers within the body and appears as a promising medication-free therapy for IBD. The Paleolithic diet is another popular diet among those who have IBD and is based on the idea that as humans, we haven't changed much from our ancestors in the Paleolithic era. This means this diet is based on the foods such as lean, non-domesticated meats and non-cereal plant-based foods, of which our ancestors would have been able to obtain by hunting and gathering. It excludes processed foods, refined sugars, legumes, dairy, grains, and cereals, and instead promotes the consumption of grass-fed meats, fish, fruits, vegetables, and nuts. The gluten-free diet is popular with those who have celiac disease. So people with celiac disease follow a gluten-free diet. Celiac disease is an autoimmune condition where symptoms which include bloating, constipation, diarrhea, and nausea are brought about by eating foods that contain gluten. Now, gluten is an alcohol-soluble protein that is found in cereals, wheat, rye, barley, and spelt, and it is added to processed foods to help them maintain their shape. The only treatment for celiac disease is to go on a gluten-free diet, and some people with IBD can have an undiagnosed gluten sensitivity, which causes a leaky gut where the permeability of their intestines allow more substances into the gut, which can trigger an immune response. Next, plant-based diets have become increasingly popular. So the attraction of plant-based diets, or the shift towards a plant-based diet, is gaining a lot of momentum in modern society due to the perceived health benefits. These diets include going semi-vegetarian, vegetarian, or even vegan, and the idea behind them with IBD is to facilitate a move away from a Western diet, as studies have indicated diets high in animal fat and low in fruits and vegetables are associated with an increased risk of IBD. Low residue and low fiber diets are also used in IBD. The terms residue and low fiber are sometimes used interchangeably, and it can be hard to provide a definitive description of them both. However, current terms used to describe residue and dietary fiber include defining residue to refer to any food that has not been undigested and remains in the bowel, contributing to the bulking of stool, and can include dietary fiber, microorganisms, cells, and secretions from the bowel, whereas dietary fiber have had many attempts at defining what it actually means, but the simplest form of defining dietary fiber can be considered the definition used by the European Food Safety Authority, who defines it as non-digestible carbohydrates plus lignin. The difference between a low residue and low fiber diet is that a low fiber diet is low in foods containing fiber, whereas a low residue diet excludes more foods than a low fiber diet and is considered more restrictive. Looking more specifically at Crohn's disease diets, there's a Crohn's disease exclusion diet. So this is a diet based on whole foods, which has been designed to reduce an individual's exposure to foods based on the premise that these foods may alter the gut microbiome or the functioning of the intestinal barrier. Therefore, it is believed that exclusive enteral nutrition is more effective at inducing remission because it eliminates the possibility of being exposed to trigger foods that can cause dysbiosis of the gut microbiota. This diet consists of 3 phases, with the first 2 6-week phases combined as one, that are combined with the use of enteral nutrition supplements in varying amounts over the phases. It works by using the first 2 6-week phases as the induction phases that are aimed to induce remission by, in the first 6 weeks, limiting the intake of insoluble fiber before looking to reintroduce or increase the intake of vegetables in the second 6 weeks. The last phase, known as the maintenance phase, is only carried out if remission occurs and does include some foods which are not recommended in the initial stages to increase compliance and sustainability of the diet. However, it should be noted that further research is required on the effectiveness of this diet as a standard nutritional therapeutic intervention in IBD. And there is another Crohn's disease diet called the Crohn's disease treatment with eating diet. So the premise of this diet is to try and mimic the composition and effect of enteral nutrition with the use of solid foods to treat active Crohn's disease. There is currently limited data on this diet, with research being ongoing. So to summarize, we have looked at the different types of IBD diets that can be used for IBD.